So the Global Health Security Working Group is really focused primarily on driving U.S. leadership and engagement and investment in global health security programs funded by the U.S., but also in multilateral fora like the Pandemic Fund or the INB Pandemic Agreement. GHC has been advocating for a new definition of global health security, one that is multidisciplinary, holistic, and centered on the safety and security of all people. I think especially following the COVID-19 pandemic, a lot of our members and incoming members as well are more interested in getting engaged in global health security conversations, and the Global Health Security Working Group is a great way to do that. We're focused on engaging with U.S. leadership and policymakers, both in the administration but also on Capitol Hill, talking about funding but also legislation pertaining to global health security. But we don't just focus on the U.S. We also look at the global picture and work to increase investment and engagement and policies around multilateral organizations like the Pandemic Fund. The Global Health Security Working Group undertakes a range of different activities throughout the year to really influence appropriations for global health security in the U.S. space, as well as legislation, so talking to policymakers, writing letters, taking meetings, but also engaging in those types of conversations in the multilateral space too, and influencing policymakers at organizations like the Pandemic Fund. I think it would be really useful for members to know that the Global Health Security Working Group and the Multilateral Engagement Working Group are increasingly working a lot together, just given a lot of the global conversations post-COVID have centered around global health security and improving pandemic preparedness. And I think that conversation will continue.